sense on for volunteers, if volunteers were say on home visitor, any community of nurses, no home visitor, any be on behubiano, all my information. Now you ensure follow up. Near timid mothers, Nakokasa, especially pregnant mothers, no. And now also lactating mothers on our for and adolescent health. Nkwala so esisu na afei na on pesa on fa nyinsa na se on ye na family planning ni nyina eboy ma adwuma ne koso ma yi pa.
Anastasia Atiogbe, Municipal Director of Health Services, Brim Central, talks about Socioserve-Ghana's intervention in the municipality.
We've been working with Socioserve-Ghana. Our main aim or purpose for this project is to reduce maternal and neonatal deaths. Some of the things that we have been able to do with them is to discuss with opinion leaders at information centers, community debates, on what their problems and needs are. Some of the cultural problems and social problems that leads to maternal and neonatal deaths. Things like arranging transport when a woman is in labor, food, nutrition, all things that make health very holistic. In fact, Socioserve have been there for us. They provided the platform. We work with volunteers, and they've even given volunteers mobile phones where they can trace pregnant women. This has helped. So we are pleading with Socioserve that the 2 years they had with us is not enough. If they can scale up, and even scale up the whole municipal. They are in 2 sub-municipals. We want them to come full scale in the whole municipal and then expand and then prolong the project so that the impact will be very, very, felt.
Irene Anuwa Ama, Deputy Director Nursing Services for Lower Manyakobo Municipal, recounts how successful the project has been in the municipality.
We have benefited a lot from the MOCAMI project. First and foremost, volunteers were trained, and these volunteers have been given mobile phones. They have contact numbers of pregnant women in their various communities. If they have any challenges, they call them. They bring them to the hospital as and when it's needed. If they can give them whatever education they have, they do give them the education. And as a district, through the MOCAMI project, because it's more of mobilization and advocacy, they've been able to advocate, especially at Spong West, where we had the VRS resettlement. We have been lobbying so long for them to release that place for us to use as a CHIPS compound. With MOCAMI project coming in, they were able to spearhead and they speeded that process. And we're able to get that facility, and now we have nurses working there as a CHIPS compound. When it comes to Pewuno, the place is quite small in the Chief's Palace, and through their efforts, the CHIPS is also trying to renovate the place so that they can expand the building so that we can get more space for the nurses to work. And then with Yokweno, they had a community center, and then with the help of MOCAMI, Socioserve, were able to lobby, and they released the community center, which the MP supported to renovate. And now we have sent staff there to work as a CHIPS compound.
The team was happy to hear from Pugli Seth Thompson, health worker at Kudikope CHIPS, on how pregnant women who erstwhile were not attending the facility because the 2 health officers at the CHIPS center are men, and the change in attendance due to Socioserve-Ghana's intervention.
Initially, we were having a whole lot of problems on the attendance of our ANC, that is antenatal. And then there was a time that an organization which is called the Socioserve came in and then have interaction with us. And then we come into agreement, and then the volunteers have done their best, and then the attendance of the ANC has been going up. Initially, we have a problem, like because they say I'm maleness, the attendance is something that is not going on well. But with the intervention and then the help of the Socioserve, we were able to increase the attendance because they help us in so many ways, and then we expect them to be in continuation of the program.
Socioserve is very pleased with the progress made in project communities with regards to maternal health. All the successful feats chalked by Socioserve-Ghana could not have been made possible without the support of Star Ghana with DANIDA, USAID, EU and UKAID as donors.
Star Ghana has been quite satisfied with the quality of implementation of the project, but also in terms of the results that are beginning to be seen. And their project actually exemplifies the advice we give to all projects, that focus not on doing what the health service is supposed to do, or focus not on speaking for communities, but focus on helping communities to speak for themselves and to enable health service providers to be able to respond to what their community's voices. All the things that Socioserve has achieved have been the result of being able to develop and strengthen the relationships and the linkages between communities and health service providers. And I think we must say congratulations to them and more grace to their elbows.
Giving the opportunity, this is a project that should be extended to other districts in the region, even other districts across other regions, and because we have achieved tremendous results. You see health workers now reporting to work early because of the collaboration that we have with the health directorates, where they are now supervised more intensively. And so if this project could be extended to other districts, we'll see that maternal health outcomes in the entire region would improve tremendously. I would like to express my profound gratitude to Star Ghana and her donors, UKAID, DFID, USAID, DANIDA, and then the EU for this funding.
Special appreciation goes to the Regional Coordinating Council for supporting the activities of the project and for launching the project. Special thanks to the entire health administration of Isuajaman, Lower Manya Krobo, Kwewu West, Brim Central, and Kwaibi Brim for offering Socioserve-Ghana the necessary support. Again, the project couldn't have been made successful without the support of all the municipal and district assemblies. Special thanks to Honorable Oklete Telabi, MP for Lower Manya constituency, and Honorable William Kwetu, MP for Odan constituency. To the chiefs and opinion leaders in all project communities, community volunteers and district volunteers, we say a big thank you.